Hey, going live today to talk about a very hot off the press, like just this month, article on functional neurologic disorders and sensorimotor errors. I'm so excited to dive into this. And if we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist. I am the owner and founder of re+active Therapy and Wellness. I'm in the Los Angeles area. I'm really passionate about functional neurologic disorders and very thankful to have some awesome colleagues to collaborate with. In fact, we are writing a paper and we met this week. This is Julie Maggio from Mass General and Heather Salon from Mass General. We are collaborating on a paper. We met this week and Julie shared this paper with me and she said, you know what? You should do an article review on this. And I took one look at the title and I was like, absolutely I should. I need to read this article and need to share about it. So that's what we're doing today. And if you are joining me live, please comment, ask questions. I love to hear from you. If you're catching the recording, you can comment below it as well. But here's the article. It doesn't even have a date on it. No, it was accepted May 3rd. So it's very recent. And it is called Experimental Evidence for a Robust Transdiagnostic Marker in Functional Disorders. It's a long title, erroneous sensorimotor processing in functional dizziness and functional movement disorder. The first author's last name is Regnoth, and it's out of Germany. Now, I have to tell you, this group out of Germany has published a paper prior to this looking at functional dizziness. Their cohort was actually primarily people with 3PD. They published a paper before looking at the same protocol. And I remember reading it and being very interested in it. Well, they've expanded. So it's always great when somebody does a small trial and then they expand. They do it again. Do they get the same results with different people? They do it with other people. Or other diagnoses, do they get the same results? And that's exactly what this group did. By the way, the article is free, full text. And if you're part of our newsletter already that I send out on Fridays to clinicians and Monday to patients, I will send this out. If you are not already on our newsletter, go get in it. You can comment newsletter and we'll send you the link to sign up. So let's talk about this article. So first thing is, who were they studying? This is still a small group of people. So they studied 10 people with functional movement disorders. These were folks that had tremor, dystonia, weakness. In fact, the table of the 10 patients, involuntary movements of the eyes and face or legs, swallowing difficulty, lack of jaw control, involuntary movements of the eyes, cramps, unsteadiness, balance problems, numbness, and so on. So the list goes on for the types of patients they saw with functional movement disorders. So they had 10 patients with functional movement disorders, 10 patients with functional dizziness. 8 of those patients met the criteria for 3PD, by the way. That would be the most common type of functional dizziness. And then also compared them to healthy controls. And they were trying to answer the question of, is there a marker of sensory motor control that distinguishes people with functional neurologic disorders from others? Because we know very well there are not a lot of diagnostic markers. There's not a lot of diagnostic tests. We understand there might be some trouble with sensory motor control, but we don't know exactly what it is. Sometimes we can do some testing to figure it out, but it's really challenging. So they had done this prior in patients with 3PD and wanted to look at it deeper. And so they were looking at this with patients with functional movement disorders. And hence the idea of this transdiagnostic marker, meaning what is common in 3PD or functional dizziness, is it also common in functional movement disorders? Turns out, yes. And it does not exist in those folks without 3PD or without FND. So there's a potential for a test like this to be some sort of diagnostic marker. So what was the test? This was really interesting. They did use some fancy equipment, which I don't have. I've never seen this equipment, but I will tell you about it. But the idea, especially as a physical therapist, this is replicable to do. But it's more accurate and objective with some fancy equipment. So what they did, and in fact, I'm going to try this out. Let's see here. Give me just one. Oh, shoot. Let's see. Oh, no. I don't know that I have the visual of it. Okay. So, sorry about that pause. I thought maybe I could share a picture of the visual. So hang in with me as I describe what they did. So they had somebody, in goggles that were set up with lights, and they could measure the person's eye movements and head movements, both the velocity and the trajectory. They gave somebody a visual cue and they asked them to turn their head and eyes to this cue. And I was going to tell you what the name of the device was, and I lost it in this paper. Oh no, I found it. It's called the IC Cam, and it is the, it's made out of Germany. I have not seen it, but it uses goggles and a measuring system similar to some things that are used here in the US as well. So they measured the person's eye movement and the head oscillations or accuracy to track with that movement. So very, very small movement and control tests. This is very common, by the way, when you're testing motor control, to have these very controlled environments to test it, because that's how you pick up change. It can be challenging to replicate these clinically, I'm not going to lie, but I think we could do it. I think there's some cool things in this. So they tested this and they looked at a person's eye motion and head motion. And then, this is what's cool, they added a helmet with weight. So adding weight to the head adds some inertia to this head movement task. And then they looked to see how the person responded to this. Now, I'm going to share with you, after we do this video, maybe I'll actually hop on and see if I can share with you these pictures from this, because it was really helpful to visually see what happens. So the person without FND or functional dizziness puts this on, they have very little oscillation of their head when they go and do this eye and head movement tracking, meaning they're very accurate. It gets right to the point. The person with a functional movement disorder or 3PD has a lot more head movement. They over and undershoot to that target. That is a direct measure of sensory motor control. Then they do the weighting, and it is expected, because you're adding weight to the head and more inertia, that initially you would actually have some over or undershoot of the target. And indeed, healthy controls have a small amount of undershoot of the target. The person with FND has a larger amount of undershoot and then a lot more oscillations to get to the target. And the person without FND learns and responds to the weight on the head very quickly. The person with FND does not. So they also tested that. I find that whole testing paradigm very interesting, because it is looking at some of the same things that we look at as physical therapists, as occupational therapists, is how does a person respond to sensory or motor input? How quickly do they respond? How accurate is it? And do they learn from it? So very fascinating. So in the outcome, really is that the person with a functional movement disorder actually looked pretty similar to the person with functional dizziness, and that they had more head oscillations with this eye movement task. And this actually replicated earlier findings of a very similar study that they did with people with functional dizziness. Always good, as I said, when a research study replicates those same findings. So I do have one picture to share with you, and that is this diagram. So I shared this in my post earlier today. Actually, let me see if I can share it bigger for you. I'm not sure. No, this is the only one I have. Okay, so this is an important diagram, and I want to tell you that for a couple of reasons. So, and I recognize it might be really teeny tiny on your phone here, but it's in the article. The article is free, full text. If you're not already on our newsletter, get on there. I will send out a link to the article, as well as our videos and all of the resources that we share every week here. That's what I do in our newsletter. Send it all to you. So this particular figure, I think it's figure 1, it was called an example of motor command updating and execution during a weighted combined head-eye gaze shift. So they're really showing mechanistically what happens and what they were studying with this paradigm. So they have this motor command, that's the green on the right, and you have this internal model of your head, right? And this internal model might not be accurate for many different reasons, by the way. We talked about this last week. For example, in a person with a connective tissue disorder or hypermobility, like in Ehlers-Danlos syndrome, or in a person with autism, might not have the most correct internal model of the body. So you have the internal model of the head. You also have, this is in the white, the internal model of visual, vestibular, and proprioceptive sensors. They're giving you feedback. And these together predict. So that's the first purple circle, predicted sensory input that would be generated by your movement. Now, that little X there is prediction error, because the prediction is compared to the actual. So we have predicted sensory input and movement. We have actual sensory input and movement. The difference between those would be the error. That error, so you see this long squiggly line, provides an update to the motor command. So what they're looking at what they were really looking at in this paradigm is if we make a shift. So you can see central nervous system down there. We make a shift in the input for the head with weight. And we're testing visual and vestibular and proprioceptive sensors. Is there a change? Is there an update? What is the predictive error? And I love a good diagram. I found this like a really, really great diagram to explain what is happening and to explain then potentially what has gone awry in FND. Particularly, they looked at functional movement disorders and functional dizziness. So I want to read you a couple of the pieces here from this. So again, the outcomes here is that people with functional neurologic disorders had more oscillations, had more errors, and this feedback wasn't updated. And meaning that maybe that particular piece of feedback was either not getting interpreted correctly by the brain, or the feed forward copy was not getting updated. And we do understand that this is a potential mechanism in FND, that there's an overweighting of that feed forward mechanism. I've talked about this before in that really great Hallett article, Mark Hallett and colleagues from 2022, the predictive brain model. So people with FND have more head oscillations with this task, and a harder time learning with sensory feedback of the weight on the head. So there are some really interesting implications for this, and they break down into major pieces. First, diagnosis. So could a test like this that clearly distinguishes a person without FND from two different types of FND, functional dizziness and functional movement disorder, could a test like this potentially be diagnostic? Could it confirm the diagnosis of FND, particularly with the sensorimotor mechanism? That is so fascinating to me. That's not what they've done here. They haven't proven that this is a diagnostic test, but a potential first step. Oh, I'll stop sharing this piece. So that is one piece. A potential, what they're saying, trans-diagnostic marker. The world needs some of these diagnostic markers because there's still so much misunderstanding in FND. In fact, I will tell you, just over the past couple of weeks, several people have commented on a post where I might be sharing about FND to say it's all in your head, it's psychological only, it's psychosomatic. And I understand that those misperceptions, misunderstandings are out there. That's what I learned in school 20 years ago also. So I know that's out there, and some people just haven't updated their understanding. Having diagnostic tests can really help update that understanding and dispel some of the myths. So diagnosis, mechanisms, as we talked about, this mechanism that of sensory motor errors being the underlying, one of, not the, but one of the underlying issues in functional neurologic disorders. So diagnosis, mechanisms, stigma. This is a really big one. What the authors say, and I want to quote it actually, here. Okay, so they pinpoint, this is their quote, that dysfunction arises from fundamental, automatic, objectively measurable processes in the central nervous system, and not from explicit expectations or conscious decisions. I cannot tell you how important that is. People have heard over and over again that they are causing their symptoms, that they are at fault, that they are faking or malingering, or that they are somehow to blame for their symptoms. This type of testing shows this is not under the person's voluntary control. It looks nothing like voluntary control of head and eye movements. This is a non-conscious, non-voluntary process that can be tested and treated, but it's very real and could not be faked. And it is actually terrible that we keep needing to say that. This is a very real disorder. It is not made up. It is not because a person is crazy. It might be that they have erroneous sensory motor processing that needs intervention that can improve with therapy. So that is the number 4 thing with this study. They didn't use this as treatment, but of course, you know me, I was like, oh, we should take this, we should test this, and we should move it into treatment. Absolutely. If we understand that person's mechanisms, first, that the feed forward or predictive mechanism is not getting updated, that they are having errors from their sensorimotor system, we can first tease out where those are coming from. Is it proprioceptive? Is it vestibular for some folks? And it is. We could test that out and help the person get accurate sensorimotor feedback from their body, and then improve their control. But we have to test it out in order to treat it. Now, I mentioned this study had fancy equipment. They could really finely tune in what a person's eye and head movements are. And most of us lay people in the clinic every day don't have that fancy equipment. So what can we do, right? So this is where I think what is really brilliant is we can take any functional task and look at how does the person perform with and without sensory feedback. How quickly do they change in response to that sensory feedback? And that might actually give us some positive diagnostic information, but also it would give us a direct treatment route. So I know they took this helmet with the weight on it, and initially it made the person's head oscillations worse. But I actually think if we were changing up that head weight, if we were training with it a little bit longer, it might actually improve the sensory feedback for the person and improve that error signal and update the prediction. That is one idea or thought. This is why we test out the sensory system, and this is why we treat it. So fascinating. But one of the things that I really loved is that they brought this back to the stigma that folks are experiencing if they have FND, that maybe they are to blame for their symptoms, that they're causing their symptoms. And it's just absolutely not true. And here's what they say. They said, persons with functional disorders frequently face stigma from healthcare providers, that's us, family, yes indeed, and wider society due to a general lack of measurable biomarkers, as well as poor knowledge and misconceptions about underlying mechanisms. And then they said, we hope our findings contribute to destigmatization. Now, this is a small study. It probably needs to be repeated quite a bit. But I'm going to shout it from the rooftops that it does help destigmatize, and it helps inform our understanding of FND as a very real issue with central nervous system sensory motor dysfunction that we can test as healthcare professionals and that we can treat so that we can help somebody get better. So again, the article, first author, Regnath, it's called Experimental Evidence for a Robust Transdiagnostic Marker in Functional Disorders, Erroneous Sensory Motor Processing in Functional Dizziness and Functional Movement Disorder. It just came out last week, and here we are talking about it. So I hope you find that helpful. Please reach out with questions, comments, your thoughts about this. How does this help you as a clinician? How does this help you as a person with FND? I love hearing from you. And I did see one comment in here or question. The internal model has been drilled in my head. So I'm not completely sure what you have meant by that. But when I was showing the picture of the internal model, of head position. I'm not sure if maybe that's what you meant as well, but this idea that the internal map of your body position might be off. It might not be getting predicted correctly in FND. That is precisely what this paper was talking about. And yes, indeed, it appears to be off, and we should test it and treat that. Now, I want to contrast that. We might do that in an externally focused way. So paying attention internally to where your head is in space, or your neck or your body, actually not helpful in FND. So I wanted to contrast that internal model versus the focus of training. I know it's gonna be a lot of words here, but in order to improve that sensory map, the internal sensory map, it actually is helpful to use externally focused training because of the attentional body attention deficit in FND. So bottom line for our providers, test sensory motor components of a person's control and treat it in an externally focused way, so that you can improve somebody's body map. So again, thank you so much for joining me today. I'm going to share that article in our newsletter, comment newsletter here. We'll send that out. It's a free full text article. I'll send out these videos as well. And I'll see you next time. Thanks so much.